see them, and I'll read them off for the mayor and the commissioner. And we'll be underway as soon as the mayor says go.
Recording in progress.
All right, well, good evening, everybody. I'm Cavalier Johnson, Mayor of the City of Milwaukee, and I'm joined as well by Kirsten Johnson, the Commissioner of Health for the City of Milwaukee. I've learned over the course of the past week just how transmissible COVID-19, but particularly the Omicron variant is. And I would like to say that, yes, vaccination and boosters are very important. Vaccination is the most valuable thing that people can do to protect themselves from the most serious consequences of COVID. I've constantly said that. Masks are yet another tool. Masks can provide an additional level of protection, and we have a mask advisory in place in the city currently. Today, I'm very pleased to announce that the City of Milwaukee just received a delivery of 500,000 N95 quality masks. The Milwaukee Health Department will begin making those masks available for our residents starting tomorrow at 9 a.m. These higher quality masks do a better job of keeping COVID at bay, and our residents should have access to that protection. I think that's critically important. I want to make sure that we provide that. The state of Wisconsin has been able to help us with this, and I want to thank Governor Evers' administration as well as the governor himself for making sure that the City of Milwaukee receives these 500,000 KN95 quality masks that we'll begin distributing soon. In the coming week, we'll also be adding to our supply of masks with an additional 50,000 KN95 masks that we're purchasing with our own resources. So tomorrow, from 9 a.m. until 1 p.m., these masks will be available at our Northwest Health Center. That's at 7630 West Mill Road, as well as our Southside Health Center, which is located at 1639 South 23rd Street, both here in the City of Milwaukee. And beginning Monday, all three Milwaukee Health Department testing and vaccination sites and Milwaukee Public Libraries will be distributing high quality masks during their normal hours. I want to thank Commissioner Kirsten Johnson and her team over at the Health Department for all the work they've been doing. And Commissioner, if you've got anything you'd like to add, I welcome you to join in now.
Thank you, Mayor Johnson. Yes, we are very excited to have some N95s on hand. Really thankful for the mayor's office and for the governor's office for expediting the process for us to be able to have these on hand for Milwaukee residents. As Mayor Johnson mentioned, we are expecting an additional shipment of KN95s next week, but we are also looking to purchase KN95s for children. At this time, the N95s we have in hand are for adults. They will be handed out in packages of 5 for a single adult, 10 for a couple, or 20 for a family. So thank you.
With that, everybody, we invite questions. Please type them in the chat so everybody can see them, and I'd be happy to read them. Mayor, the Journal Sentinel asks, how were these procured and why did they become available now? Perhaps Commissioner Johnson, you can address that.
Sure. So we've been working on procuring N95s and KN95s for a few weeks. And as of today, we received the shipment from the state and from the governor's office of the 500,000 N95s. We expect and we hope this supply lasts us at least through the next 2 weeks, but we do have additional masks coming in over the course of the next week.
And Mayor, the next question, wondering if you have a response to what the Milwaukee Teacher Education Association told Channel 12 this morning. Their statement reads, MTEA has been asking for a mask mandate for 5 months. We're seeing mounting pressure from multiple organizations and leaders across the city for a mask mandate. But the commissioner makes every excuse under the sun. If she doesn't have, sorry, I'm seeing where it's fun. Well, you get the gist of the question. They have elevated the rhetoric on this. I think the response from the city has been pretty consistent. Mayor, I'll invite you to start, and Commissioner, I'm sure you'll want to chime in.
Yeah, and thank you for that. Look, I have said consistently that we will follow the science. We will listen to the actual professionals and experts on COVID-19 and those in health, the leaders in health as well. And that's how we'll make decisions on this. And Commissioner, if there's anything else you'd like to add to that, I welcome you to do it. But that's where my decision making has been, is following the science and following the advice of those who are the actual experts on COVID-19.
The next question from Michelle Fiore: is there any talk of changing the mask mandate?
Well, Michelle, you probably have seen that today the Common Council's Public Safety and Health Committee took some action on a mask mandate. And now that is going to be under review. I mean, listen, right now there is a mask advisory in place in the city of Milwaukee. In my advice, to residents of the city is to follow that mandate. As a matter of fact, my advice to anyone within our region and across the state is to follow the mask advisory that's been placed out by the Milwaukee Health Department. But the council did take some action today. It's got to go through the entire process, get to the Common Council on the 18th of January, and we'll have the opportunity to review that as it comes up. But absolutely, folks should be wearing masks. That's what the advisory is asking people to do in the city.
The next question has to do with the KN95 mask use. How long can you wear a KN95 mask, and does its efficacy fall after wearing it a few days? Commissioner, do you know the answer to that?
That's a really good question. Sort of the general guidance is they can be worn for roughly 5 days. There's information online, and I'm sorry, I'm not as well versed in KN95 and N95s and the varying efficacy after a period of days, but they can be worn for at least 5 times. And they should be stored in a dry, like in a lunch bag that helps to keep them dry from absorbing moisture, but they can be reused. But partly the reason we plan to give away 5, 10, and then 20 is to assure that people have access to more than one mask. So it should get them through a couple of weeks.
The next question: is there COVID testing tomorrow at those 2 locations? And if so, are there any concerns these locations could be overrun with people picking up a mask and getting COVID tests?
So we are planning on providing testing and vaccinations at both of these sites tomorrow. So for people who are there to get a vaccine, we ask that you turn your flashers on so you can get pulled out of the line if there is a line. And for individuals who are there to pick up masks, they will just be handed to them rather quickly so they can get in and out of a line. But we are working on traffic control to assure that that people have access to the mask quickly.
The next question from the Journal Sentinel has to do with the limitations of the proposed council mask mandate. Do you believe it should include, or it should not include, an enforcement mechanism? And then I think you've already addressed whether you plan to sign it. And then I think the commissioner already addressed the number of masks people can get. So with respect to, should it include an enforcement mechanism?
Yeah, thank you for the question. And to answer the second part first, yeah, I think I did address that somewhat in my initial response, in that, I believe that the council action here could have an enforcement mechanism, but that's going to be tricky. And we're going to follow the science. We're going to work with the commissioner. We're going to work with folks in the health field in order to determine what the direction on this should be. I'm not going to say right now exactly about what the enforcement should be, because we haven't had the chance to review exactly what is in the legislation. My understanding was that towards the end of the conversation there was some discussion about potentially changing the legislation. So we're not certain of even what it means just yet.
All right, thank you. And we'll take one final question. Perhaps Health Commissioner, you can take this one. What guidance do you give shelters for those experiencing homelessness, given how cold it is and the contagious variant that's out there?
Thank you. This is actually a great question. We at the City of Milwaukee Health Department have an entire team of people who are dedicated strictly to supporting the shelters, both in terms of testing. So our rapid antigen test supply has been used almost exclusively to support our shelters for those who are experiencing homelessness, to assure that they're testing people as they come in, they're testing them periodically, and then if somebody tests positive, we are actually at the City of Milwaukee Health Department in collaboration with the county, transporting people to isolation facilities and helping to staff those facilities, and have been pretty heavily for the last 3 weeks to assure that there's limited spread in those settings. And we are also providing them N95s.
Very good. Commissioner and Mayor, thank you for joining us. We'll conclude now.
Thank you.
Thank you.